Atypical pneumonia or interstitial pneumonia. It refers to the infection which occurs in the interstitial space of the lung. And in case of atypical or interstitial pneumonia, the cough is non-productive. The agents of atypical pneumonia are respiratory viruses like influenza virus, coronavirus, RSV, that is respiratory syncytial virus, Epstein-Barr virus, and adenovirus. The bacterial agents causing atypical pneumonia are Mycoplasma pneumoniae, Chlamydophila pneumoniae, Legionella species, that is Legionella pneumophila. So there are the etiological agents are respiratory viruses or atypical bacteria like Mycoplasma pneumoniae, Chlamydophila pneumoniae, and Legionella pneumophila. See, Mycoplasma pneumoniae, it is also called as walking pneumonia because the symptoms are milder than the other agents causing pneumonia. Primary atypical pneumonia is also known as eaten agent pneumonia or walking pneumonia. The other names for primary atypical pneumonia are eaten agent pneumonia or walking pneumonia. And this is caused by Mycoplasma pneumoniae. Mycoplasma pneumoniae causes atypical community acquired interstitial pneumonia, and this is similar to the pneumonia caused by Chlamydophila pneumoniae and Legionella pneumophila. So this is known as walking pneumonia क्योंकि जो typical pneumonia है उससे atypical pneumonia का जो symptoms होता है वो mild होता है. The symptoms are milder than the pneumonia due to other agents. The onset of atypical pneumonia is usually gradual and it is characterized by wheeze or rales with dry cough and peribronchial pneumonia with thickened bronchial markings and streaks of interstitial infiltration on chest x-ray. Chest x-ray पे we will see diffuse interstitial infiltration. Okay, there is interstitial infiltration in case of atypical bacterial pneumonia. So dry cough होता है, it is also characterized by wheeze or rales, and there is peribronchial pneumonia with thickened bronchial markings and streaks of infiltration, interstitial infiltration on chest x-ray. So the radiological finding will be interstitial infiltration on chest x-ray. The prognosis is good. Atypical pneumonia is usually mild and self-limited, but in some cases it may progress to severe disease with ARDS, that is acute respiratory distress syndrome. In some cases only it can progress to acute respiratory distress syndrome. The treatment of the pneumonia by Mycoplasma pneumoniae is macrolides. Macrolides are the drug of choice like oral azithromycin. The alternatives are doxycycline and respiratory fluoroquinolones. In case of atypical bacterial pneumonia, macrolides are the drug of choice. The laboratory diagnosis of Mycoplasma pneumoniae. Specimens can be throat swabs, nasopharyngeal aspirates, bronchial brushing, BAL, and lung biopsies. So, throat swabs, nasopharyngeal aspirates, bronchial brushing, BAL, that is bronchoalveolar lavage, and lung biopsies are the specimen in case of Mycoplasma pneumoniae. The culture can be done on solid medium containing PPLO agar or liquid medium containing PPLO broth. The solid media containing PPLO agar will have fried egg appearance colonies, and the liquid medium containing PPLO broth will produce turbidity and a color change. So culture के लिए we have solid medium containing PPLO agar which will produce fried egg appearance colonies, liquid medium containing PPLO broth will produce turbidity and a change in color. Identification, accurate species identification from colonies is made by biochemical test or by automated identification such as MALDI-TOF. For antigenic detection, we have direct IF and antigen capture ELISA. Direct IF and antigen capture ELISA is for antigenic detection. For antibody detection in serum, we have two types, specific and non-specific. Specific includes indirect IF, latex agglutination test, and ELISA using the P1 antigen. And non-specific antibody detection test is cold agglutination test and streptococcus Mg test. See, antigenic detection by direct IF and antigen capture ELISA. Antibody detection can be specific, non-specific, specific by indirect IF, latex agglutination test, or ELISA using protein P1 antigens, and non-specific by cold agglutination test or streptococcus Mg test. And molecular methods, this will detect 16S rRNA and P1 adhesin gene. Molecular methods will detect 16S rRNA and P1 adhesin gene.